All right. Well, hello, everyone. Welcome to Curitics Connect, the podcast where we explore leadership, innovation, and transformation in healthcare. I'm Danielle Meldru, joined by my co-host, Ryan Weber. Today, we are super excited. We are joined by Kelly Robinson, founder and CEO of Platinum Group Advisors. Platinum Group is a boutique consulting and advisory firm. Kelly brings more than 25 years of executive leadership experience across healthcare, including serving as a CEO, Chief Development Officer of a Fortune 5 company, and as a board member for both industry and volunteer organizations. Welcome, Kelly. We're so happy to have you today.
Oh, thank you so much, Danielle and Ryan. It's an absolute pleasure to be here.
Awesome.
Absolutely.
All right. So Kelly has also led strategy and operations. I think this is important because we asked Kelly to be here today across different complex healthcare models like value-based care, financial risk, and clinical integration. Some of her experience spans the full spectrum of corporate transactions, from startups and turnarounds to mergers and acquisitions in both public and private sectors. So again, Kelly, thanks for being here. Excited to dive into today's conversation.
Absolutely.
Kelly, I'll start with a quick question for you, if you don't mind. Just do a little warm up here, get a little background on yourself. Can you share a little bit about your career journey and what led you to founding the Platinum Group Advisors?
Sure. I'm kind of embarrassed to say how long I've been working in this industry, but I actually started in healthcare as a teenager. So I started very early on working right inside physician practices and pharmacies. And so my love and passion for healthcare started very young. I think that by being right there in the offices, I was able to really see firsthand what providers go through and what they need and see the interaction firsthand with patients. Right out of graduate school, I took on a role that I think really shaped my career. I worked for a startup health plan. It was a managed care health plan focused on Medicaid. And I was one of the first few people hired and helped build the plan from scratch. And I think that if I hadn't had that experience so early, I wouldn't have become so driven and passionate about startups, building, growth, scaling. By being able to see how the entire organization worked and not just coming in with one stream of expertise that you build upon, I was able to see how the whole ecosystem worked. And I think that that's what really shaped my career, getting into my areas of business development and growth and contracting and all the things that I did through the years. So from there, I went into the private sector, where I've spent almost my entire career, mostly on the provider side, and spent many years at a very large medical group in the San Francisco Bay Area. And we did a lot of cutting edge things early in the day. We were doing value-based care and managed care before the terms were really known. I mean, we were one of the first clinically integrated groups before people didn't even know what's clinically integrated, we would be asked. So did a lot of things kind of at the forefront and spent many years doing that. I then took that onto a national scale with Optum Care and did a lot of work building and growing medical groups around the country, and then returned to the San Francisco Bay Area as CEO and led the organization through a lot of change and growth and sale. And it was really post-sale of that organization that I decided to start board work and Platinum Group Advisors. I feel like I've seen so much through the years, what works, what doesn't work, medical groups, health plans, hospital systems, technology solutions that are single point versus ecosystems that you build into. And I just felt like I would be better served or fulfill my passion by helping multiple organizations and not being embedded within one. So by doing board work and advisory services, as well as helping different companies through growth, scaling, startups, transformations, it's just a kind of fulfills all the bucket list items that I'd love to round out my career.
That's amazing. That's awesome. Sounds like you're a purveyor of wisdom now at this point in your career.
Well, yeah. I don't know about that, but I try to share what I know.
Yeah, that's great. That's great. I mean, it's such a beautiful thing to be able to have all those experiences and then turn that around and use them to help other people go through a similar avenue, as they build their careers and companies. So very cool. Very cool. I had one more question for you, if you don't mind. In terms of like I know you talked a little bit about your roles, right? In terms of CEO and Chief Development Officer of all of the like larger companies and some smaller companies along the way there. Like in terms of and you hit on this, but I think I want to drive it home for our listeners. What has kept you passionate through all of this? Is it the providers? Is it the patients? Is it the outcomes? Like where does your heart lie in all of that?
Yeah, it's a really good question. I think that I've always gravitated toward the provider side. It doesn't mean that I'm not interested and passionate about all of healthcare, but
Sure.
I really do feel, and I've said this for many years, if you really take a step back and look at how the entire healthcare system works and all the players that are needed within it, it is really the provider who is driving all of those different pieces, where the patient needs to be referred to, what prescriptions they need, what technology is going to be used to connect between the two. It's really the provider who's driving the majority of those healthcare decisions that are being made. And so I think that that's where my passion has always been, is probably started from a young age of, I want to get right to the root of where things happen and where you can actually drive change. So I think that that's probably the biggest, although there are many.
Yeah, of course. It has to be to get to where you are today. That's amazing.
Yeah. Well, I have to just put in a quick note. I loved hearing, Kelly, that you've been in this industry starting as a teenager. I found myself in the same situation as a teenager just graduating high school, and my mom was an executive at Cigna. And I got my feet wet just kind of going into that world, not knowing anything about the payer space, but growing up, I always heard about claims payment. That was like the world. So I started doing internships through the summer. So that was like my first purview into the healthcare landscape outside of just traditional medicine and going and seeing your doctor and stuff, and not really understanding how the administrative portion of it works, right? So very cool to hear you were right there. I guess we're lifelong healthcare.
Kindred spirits. Now we know why.
It's so true. Well, that leads us to our next question that I have for you. And I will tell you, as a female in this industry and a fellow leader, I look up to you. I have now for a little while. I have been following you separately, and then just I love to see fellow female leaders that have worked their way up and have held executive leadership roles and have been successful in them. I think it's wonderful from one person to another to see that. But I wonder, in this healthcare, high-paced tech environment, what do you think are the most important leadership qualities that you feel are most critical from your perspective?
Gosh, there are so many. I think that given the pace of change in healthcare, well, first of all, actually, let me take a step back for a second. I think that healthcare is one of the most complex industries out there for so many reasons. And, you look at how far behind healthcare is to some degree in advancing solutions and getting better. When I think about, we're all here to make the health system better, that's tough. I've been doing this for over 30 years, and sometimes my business partner and I sit back and go, gosh, have we made it better? There are advances that we've all made. There are brilliant people in the healthcare space, but it's so complicated compared to others that I think we have to keep that in mind. So in terms of qualities that are needed to make great leaders in healthcare, it's being able to pivot. It's recognizing that things are going to change constantly. It's knowing you need to be thinking of the future, preparing for what everyone needs to make it work. It's operational excellence. It's the compliance aspects that come into it. But at the end of the day, having a purpose, to me, one of the best qualities is knowing why we're here. We're here for the patients, and we're here to help people be healthy. We're here to help providers be able to actually provide care and not deal with all of the other things that come onto their plate. So being purpose driven and knowing why we're here and trying to always not try to stay still. We're trying to get better. We're trying to improve. We're always trying to innovate. We're always trying to find new ways of doing things and not just getting comfortable and staying still with what we're doing.
Yeah, I think that's a beautiful answer. I mean, honestly, some of the best leaders that I've worked for have always had this way about them to where in a bad situation or in a good situation, they have the same response. It's more or less like rally the troops, like equanimity, if you will, right? Let's get together, let's figure out a plan, let's move forward. And there's this rallying cry behind that as a person who wants to be there with that leader to grow and work together. That to me, I think is a huge aspect of that. I think a lot of what you just mentioned is built in that. So, have you seen leadership change a lot in terms of the smaller companies? And look at this from like the Fortune 200, the startup space. You saw it in your starting part of your career as to where you are now in an advisory role, right? How have you seen that space change over the course of your career?
It's interesting. I think I actually get asked this question quite a bit, having been within huge companies and also working with startups. I think smaller startup companies, there's all the obvious traits, which is leaders and teams need to be scrappy to some degree. You have to be hands-on. Like we just talked about, you have to pivot even more. I mean, you just have to pivot all the time. Whereas in, larger organizations, you're really striving for consistency, you're striving for standardization, you're striving for scalability and size. But there are a lot of things that are actually very similar. If you think about it, in startup organizations, you're trying to, it's proof of concept, right? You're building something new, you're innovating, you want to make it work, you want to prove that it works, and then you want to scale it. But in a very, very large organization, yeah, you might have made it to a Fortune 100, Fortune 20, Fortune 5 company, but how do you stay there? The pressure is on every day, every hour, right? Yeah. So you still have to innovate all the time. You have to be cutting edge. And so while there are some differences in, hands-on versus, to some degree, we're all still after the same thing. You have to constantly innovate. You have to constantly pivot. You have to constantly better the organization, whether you're small or whether you're huge. Yeah. So I actually do see more similarities than not through a lot of different experiences that I've had.
I would imagine that the microscope is maybe a little bit larger in companies that are larger organizations, right? Because there's just more Absolutely. Individuals on you at all times, right? And and like I said, that microscope to see what you're doing. Whereas, sometimes in startups we can fail a little bit more, right? Because it's us judging and on ourselves. But yet the work effort and the challenges and the need for pivoting is constant. Like you said, I think on both sides of the house that they are. But I know that for myself, as a leader in the startup world, in a healthcare technology organization, resilience has continued to be tested time and time again, and the need for pivoting and the need to evaluate and consider, okay, what do we take the lessons learned from that last decision that may have not been the best and utilize it to allow us to get to the next rung or be better or stronger. Do you have a situation in your experience as a leader that really tested you and how you had to work through it that you would be willing to share with us?
Yes. Of course, there are so many to draw from. Situations. Yeah, you hit something really hard. Resiliency is so critical, especially in startups. I think in terms of when I've been tested the most, I mean, there's one that really comes to mind that was just, kind of everything, the perfect storm, a lot of things coming at once. And I'm going to talk about COVID. And it not just, everyone dealt with COVID, the entire world dealt with COVID, and every company dealt with it. Being not only in healthcare, but in a provider organization, we had physicians who didn't have access to protective wear. We didn't know what the rules were. Patients, how to actually get the physicians and the patients to be able to see each other. So having to deal with it not only from the employee standpoint and running the company, but actually being in healthcare with people on the ground, treating very ill people and trying to figure out how to even run their practices and still maintain access was a significant challenge. But at the very same time, after an almost 2-year process, we were in the final few months of selling the company.
That's amazing.
And so in lockdown, in the midst of COVID, we were transacting the biggest thing that had ever happened for the organization. And to be able to communicate with employees, communicate with physicians and shareholders, and complete this major, pivotal moment for the company virtually was huge. And pivoting back and forth between both of these going on at the same time, and making sure that everyone felt not only safe and good about everything that was happening and how we were handling both COVID and the transaction, but the future and where this was going to take everybody, and how these could connect together to be a good thing for the organization and for everyone involved. So that was truly a test of resilience and sleep and and all of those things. But I think that at the end of the day, the only way we get through resilient times, it's not about the leader of the organization. It's not about one or two people. It's about teamwork. It's about collaborating and bringing everybody to the table to make these things happen.
Spot on.
Yeah.
I heard an old proverb not too long ago that said that essentially right before you meet your goal, the universe has to test you the hardest to make sure that you're ready to meet it, right? So the fact that in the midst of all that chaos, you guys were still able to close the sale and kind of achieve that ultimate goal is honestly just a testament to the hard work and everybody on your team. So that's amazing.
An amazing team. Yeah.
I often wonder, when you hit such a pinnacle in your career in terms of like what you were able to achieve there, how do you determine what you do next in terms of where do you go? I know you founded Platinum Advisors Group now, and you're in the throes of that. But what was that transition like, just from a career standpoint, from that ultimately that sale there until this where you are now? Like that's something that just I selfishly want to ask, because I think it's a really beautiful thing to see someone reach that goal and then to see like where they go next, because I think sometimes that can foster even more, like you kind of change your perspective. At least some people I've seen, they either go back into that hustle and grind, let's go do something and do it again, or like, where can I now make a difference at this point in my career? And I think that I'd love to hear your perspective on that.
Yeah, I think that it's different for everyone, and what stage of your career you're in, what drives you most, like what after looking back at everything that you've done and to date, and what are you most passionate about, what fills your bucket the most. I'll share, like, for me, leading the organization through so much change and accomplishing a lot for the physicians was really important. I missed being all over the country, like I was in my Optum days, and the exposure and insights that it's not just about bringing your experiences to others, it's what you learn from them too. And I really enjoyed being all over the country and meeting different groups and working with different people. And so kind of taking that step back and saying, where should my next chapter be? It's, where can I, do the things that I enjoy the most, which is truly growth, strategy, I like to build things, and to be able to do that, for multiple organizations at the same time, it was an easy transition for me, honestly, because I knew what I enjoyed. We all know what we like to do and what what comes along with it that we have to do. And when you can, try to really, pivot towards where your passion is, that always feels like the right answer.
Yeah.
Absolutely.
Well,
that was a easy answer for you. I love it. Go ahead, Danielle.
No, thank you. I think that lends to another question that I have. As somebody that has been in multiple leadership roles throughout the years, and you had mentioned that you really feel like the success of where you were during a really trying time of COVID was the team that you had built and the team that was surrounding you. So I guess that leads to my next question for you is, once you've built this strong team, right, whether it's at an older organization that you worked with, or even you know what you're doing right now and your partner, and as you're bringing in new resources to help your clients, right? How do you create that culture in this high-paced, fast world that allows you to retain the talent while also developing that talent that you find yourself working with?
Yeah. You know, I actually talk about this a lot with people. I and people who have known me for years, I've been saying this for years. Great companies, they're great because they have great people. It's the people who make companies great. So it's not just about hiring the right people. That is huge. Hiring the right people, getting people in the right roles where their passions can play out, where they are at their best. That's what makes a good culture, right? If you have people who are aligned on the mission, aligned on the why behind what you're doing, they believe in what you're doing, that makes them excited about what they're doing. Well, that cascades to others. That becomes, you know, a part of the fabric of the organization. So great people are the culture. And so I think that by hiring great people, guess what they do? They turn around and they hire great people too. And,
trickle down, yeah.
And so when you have alignment throughout the organization of people who know why they're here, what we're doing, how they contribute to making a difference, they feel like they know, they're a part of it. The culture just kind of takes on a life of its own, right? It becomes a natural extension of the people who are there. So that's in terms of the people and culture. I do think, though, having great people in place and hiring good people, it's a constant investment in them. It's pushing people a little bit beyond their limits, beyond their comfort zone to try new things. It's allowing people the exposure that they need to learn so that they can grow. So to me, it's not just about hiring people who can do the things that we need to do today. It's about investing them and giving them the exposure so that they're your next generation of leaders. So just that constant loop of positivity, the constant loop of investment and training in people and exposing them and pushing people beyond what they can do.
Yeah, that's beautiful. I actually was talking to Umesh not too long ago about this. And for those that don't know, Umesh is one of our compadres here and what all that we do. And Kelly knows him well. But we were talking about some of the interns that we have on the staff here that are with us, and he's saying, you know, one day, wouldn't it be amazing if we could take what we've done here and turn around and give some of the funds from all this back to these interns and say, listen, you guys have the young ideas. You are the next, you know, future in this wave, and allow us to guide them through their growth journey in becoming the entrepreneurs of the future. Mm-hmm. So, that's what I think you're building people up while you're building your teams and giving them that exposure and the capability of like that growth within the organization and being able to guide them along the way, because there will be missteps. You know, we can't grow without our failures, right? So that's a great way to look at it.
That is such an important point, Ryan, and I do think that ties back to not only successful companies, but to the differences that you sometimes between leaders with startups versus larger companies is creating an environment where it is expected that we're going to learn. It's a learning environment. It's a learning culture, right?
Yeah.
Where you have to be willing to accept that there are going to be some failures along the way, because that's part of the journey of innovation. You can't innovate without trying. It is new, right? That's what innovation is. So if you're trying new things, it's not always going to work perfectly the first time. And I think that is, it is a leadership trait to be willing to accept that and to be open to the impact of failures along the way. But if you don't do it, you're going to stay in place.
Yeah.
You certainly have to keep your ego in check and be very humble.
We're always checking our ego at the door at Curitics,
Right.
I think I will say from a cultural perspective at Curitics, it's very important to us. Companies say it all the time, culture, right? But I know that from the onset, it's been one of the key ethos to who we are and how we grow and how we continue to bring people onto the team, and how we ensure that everybody feels like they are a part of something. From top leadership, we try to keep things flat. We really work to we all wear many hats. None of us are too good to do this role or that, but focus on, like Ryan had mentioned, the interns that we bring into our organization, those that maybe are just getting into their professional career, but they want to do something, they want to be a part of a growing organization where they can try to make a difference or expand their skill sets. And we really work hard to say, right now we need this position, but we found somebody that has some drive and grit and they're teachable and we're willing to put in that time. And that is a core value of ours that we will always try to maintain within our organization. So I think it's really refreshing, Kelly, to hear you talk about that. That's a core value of yours as well. And as you've been a leader throughout these different organizations and where you find yourself today. So I truly appreciate you sharing that, and I think that's why we are aligned, and one of the reasons that we feel grateful at Curitics that you have come on board and you have agreed to be an advisor with us, and you help kind of steer and guide us in some of those decisions as we're trying to make our way through this complex regulatory controlled compliance environment of healthcare, with things changing rapidly, as we all know, trying to figure out how we're going to hold on, scale, and overcome some of those challenges that we find ourselves. But I would love to pick your brain a little bit more, if you don't mind, and get a better understanding from your perspective, and historically and even currently, what are some of the most common operational challenges that companies are facing when they're trying to scale their health tech solutions?
Yeah. I could actually talk all day on this. You might have to tell me to just, okay, that's enough. Let's move on. It's hard to separate the two. I want to talk about it from two perspectives. One is the tech companies themselves, and like a Curitics and the amazing things that you're building, and then the customer side, the medical groups, the health plans, the healthcare entities that are trying to implement it. When you think about the companies that need these solutions and that are working to implement them, there's a couple things that I think any tech company needs to really keep in mind to ground themselves. The margins in healthcare are really, really small. They are tight.
Yeah.
And going back to one of the first things that we talked about, healthcare is really complex. It is not a one-size-fits-all. Unfortunately, a solution that's built for a health plan doesn't necessarily work perfectly for a medical group. What works for a hospital doesn't necessarily work in other settings. It's a very complex industry. So what I find in companies I've been a part of and companies that I advise is that so many tech solutions that come out are a single point solution. They're going to create this perfect solution for one aspect. And if that was in isolation, wouldn't it be wonderful? But how is that now going to interact with all the other pieces that we need technology to help solve for? How will it interconnect? How will they talk to each other? What's going to cost? So what happens is all these tech companies that come out with single point solutions, it's too expensive, because if you're paying this for this one here, this for that one there, when you add them all together, it's too much. Plus, you lose consistency. A lot of things fall through the cracks. So your accuracy goes down. It could actually have a negative impact on the organization's operational performance because they can't talk to each other well. So the more solutions that are built, that are multifaceted, that are built for the ecosystem, the better it's going to solve the problems for the organization, and the easier it's going to be to grow and scale. Not only within an organization that's trying to scale using the tools, but to the tech company that wants to scale the sales of the solution that they've built. More entities will be able to use it if it can solve more problems at once. And I know you didn't bring me on to talk about Curitics, but to me, this is actually a really good example of why I think Curitics is such a fantastic solution. It's built by people who have actually been in the space. They know the needs of the providers, of the patients, of the health plans. They know the user needs. You all come from that world. So you know what works and what doesn't work. You've created a suite of solutions that all talk to each other, that you've already thought through how it's going to interconnect and work with the various systems that all these different entities around the country use. And it's multi-product. It's not just for Medicare. It's not just for commercial. It's creating a suite of solutions that solve more than one problem and can work across the board. And that's what we all need in healthcare. We need technology to solve more than one problem at a time, and to be able to talk to other solutions that we also need, either to have it built into it where you don't need multiple systems, or the ability to connect well with the other systems that are required. And
Awesome.
that's the biggest thing.
Yeah.
There's just too many. We talk about bolt-ons, and I've helped in companies I've been in, and I've helped clients map out. Do you realize how many different systems you're using to create this ecosystem? And you end up with these maps with arrows all over the place, and it's too many.
Yes.
So
It becomes way too complex,
Yeah.
very expensive.
Yeah. and
Yeah.
The overhead is hard.
yeah.
That's the ethos of what we've attempted to create
Exactly.
here, right? We came. I know myself and Chris both come from the Salesforce world, and while it's a wonderful product, and I would never say anything negative in that regard. It's just unfortunately sometimes there is a need to put a lot of those additional bolt-ons, if you will, right there, and we found that over and over again, and it was cost prohibitive in a lot of ways to actually complete the programs that we wanted to be able to use to help those groups, as you talked about, the medical groups and the folks that we were working with from a contracting perspective, and all the different organizations that we've worked at. So that we've learned from that and really tried to become a purveyor of that not a single point solution, creating the world, but that actually, it comes with its own set of challenges. As you probably know, we are now, as Danielle said, at a leadership level, we're friends first, and we try to keep everything flat, but we wear many hats. And I'd love to hear your perspective on how in the past have you been able to maintain your vision and the growth from an operational perspective while being stretched thin from a resourcing pool, right? And also, just in your own role, knowing that you have this precipice and this ramp of growth, but there's this challenge of there's only enough hours in the day.
Yeah.
You have to manage family and everything else that you have in your world.
Yeah. One of the things that I struggled with myself in companies, and I work with clients on this all the time, is when you're stretched thin, margins get too tight, or you're just stretched thin and you know what you're doing, you just don't have enough resources, or how do we spread it out and get the work done? We need to spread it over a longer period of time. Whatever the reasons are. The most common thing that I see that people gravitate to is, I need to take care of today. I need to keep things running the way we do it today. That's our bread and butter. This is our priority. But if you don't always have one foot in the future, that's a cycle that's just going to repeat itself, and you're going to find yourself right back in the same place, that you're stretched thin and you don't have what you need to get everything done. So to me, it's calibrating constantly between how do I use resources for what we're doing today, what we have, and what we need to keep going, and what we need for the future to get us, where we're trying to go. It really can't be one or the other, and I think that that's a common thing that people do, is go, well, we have to just focus on building the new thing because that's going to be better, or no, we just need to, this is our bread and butter, we just need to keep this moving, and let's just put that off another year or two.
Yeah.
And
don't rock
if
the boat.
you're not-
Don't rock the boat.
Yeah, so to me, it's about keeping both going. They can't
Which
be
is
perfect. You can't do
challenge.
them both as well as you want, but you have to keep them both moving, the current and the future.
Yeah. It's a delicate balance, and I don't know that there's a perfect answer to either, but you nailed it, Kelly, in the when times get tight, whether it's from margins or delivery timelines, right? Or expectations. You find yourself in a situation, especially in a growing organization and delivery for clients, right? It's like, I gotta do what is in front of me today. Let's focus on today, let's get that done. But you find yourself in this constant cycle of just putting out the fires of today, right? And not thinking through the strategy of the future of how do we ensure, one, that these fires don't happen again the same way, but we're building a better product that maybe doesn't go on fire or something like that, right? So it's continuing to manage that balance. That is a struggle. And I know for us here at Curitics, we find ourselves in that on a daily basis of meeting the demands of today, our client needs today. And we always want to make sure that we remain focused from a client perspective. We never want to lose that our clients are number one, their needs are number one. They have to deliver to their clients, their patients, their doctors. And our tool helps facilitate that, right? So no matter their needs, we need to make sure we accommodate and we're there. But at the same note, we know we have future client needs and regulatory requirement changes and things that we have to ensure that we're up ahead and we're able to handle when that comes. So we still probably haven't found the perfect balance. I don't know if there ever is, but we continue to remain focused on ensuring that we can do both of those while managing our resource pool and what's available to us.
Yeah.
So
And
you
future
nailed it
items
in
that you're building, your current clients need them too.
You're right.
Yeah.
Yes. Great
Yeah.
point.
Yeah.
Great point.
You have to have a little fun while you're doing it too. That's the other
Brian
part.
likes the innovation, Kelly. He's all about what's the next thing we can build. Him and Chris put on those hats, and they're so excited about what we can do, right? What we're not doing today, what we can do better, how we can keep growing this. So it's always like that perfect balance. All right, guys, but I need you today. We got to manage this. So the fun stuff, as Ryan likes to say.
That's right. The fun stuff. That's right.
Well, real quick, Kelly, we like to, as we kind of close up stuff, we get to what we call our rapid fire round. And we close each of our segments with this quick answers, no overthinking. We'll ask you a question, and then the first thing that pops in your head, if you can give it to us. Sound good?
Yes.
Okay.
I'm ready.
All right. So I'm going to go first, Ryan. I'll throw
Go for
one
it.
there at you. And this is probably a selfish question. But what's one leadership book or resource that you always recommend to anybody in this industry or outside of this industry, or maybe people that are looking to you as a mentor?
Simon Sinek, what's your why? Start with why.
What's your why? Okay.
That has become my mantra in life. I am a huge fan of him and his work and his perspectives. But to me, it's all about what is your why? And in fact, we already talked about it here today.
Yeah.
What's the why behind what you're doing? Because that's how you get people engaged. That's how you get people excited. That's how you get people to believe. And if people believe in what you're building and what you're doing, they are going to be so committed to it. It's going to be a better outcome for everybody, and that's what carries you through into the future. So
That's
I
awesome.
love that. I'm gonna have to pick that one up. I have
Yes.
Watch
my
that
wife.
video.
My wife
There's
thinks
a
I have a
video.
book problem.
great one.
Oh, really? Okay. I'll
yeah,
check
he
it out.
has a TED Talk video that summarizes it. It's fantastic.
Oh, I'll definitely check that out. Maybe I'll do that instead. I've been getting the hand slapped about how many books I've been buying lately. I've been on a little bit of a run. My wife.
Knowledge is power.
It is, yeah. I spent a lot of time. I was one of those guys, like after college, I was like, I'm not reading the book. It's silly. I don't want to do this. I can learn anything from the internet or whatever. And I spent years doing that. And then I got back into reading, and I'm like, oh my gosh, I missed so much. And now I'm just like, please give me more of this knowledge. It's wonderful to learn from. So I appreciate the recommendation. All right, my question for you today is, like, what's one tech trend, especially if you could make it in the healthcare space, totally up to you, but that really like excites you, that's changing how you see where this industry's going, or just tech in its whole?
You know what? I think that what excites me the most is the trend towards empowering patients. So anything that is patient-centric now, because I think that patients want to be consumers. Consumers want to be empowered. They want to be a little bit more in control. They want to be independent. And to me, the more tools that are coming out to where people can drive more on their own and get to solutions, I think it fulfills the desire of the consumer to feel like they know what's going on and that they're a little bit in control. But honestly, it also drives, costs down in the system and makes, frees up time for people to do what really is really needed within the provider and health plan and all those spaces. So I really think it's about empowering patients and those tools.
Awesome.
That's great.
Thank you.
All right, I got one last one for you, Kelly. If you could go back, what's one piece of advice that you would give your younger self? So the younger Kelly.
So many to choose from. I think it's about just be yourself. When I think back on
authenticity.
Yeah, exactly. I was just going to use that word, and I know that I love the word authenticity. I use a lot. I know it's becoming a bit overused these days, but being yourself, being authentic, at the end of the day, that's what really matters. And I see in myself and other leaders, there's this sense when you're growing up and becoming a manager and becoming a leader, that you need to be tough, you need to be, you need to have it all together. But really, when you think about leaders that you admire the most, when I think about leaders that I've looked up to through the years, they're approachable, they have some humility, you feel like you know them, and that's because they're being themselves. They're just being true to themselves. And I think that the earlier in one's career we can learn that and just embrace it, the more effective we are as leaders.
I love that.
I love that. That's awesome.
I'm going to go back to my wife again. She's a woman of wisdom, just like yourself, Kelly. So she told me recently she met someone, and it was the first time in her life she had ever met someone who could be vulnerable and strong at the same time. And I thought, wow, what a beautiful combination. But I think you have to be that as a leader, because that's what makes you feel human to the people that you're working with. So they can see you go through the emotions of the ups and the downs of an organization, right? And at the same time, lead them through that and kind of navigate it with that wisdom and grace and strength at the same time. So I love that. That's a great feedback.
None of us are
I wish I
ever
could tell my
perfect,
old
but
self.
as long as we're striving for it,
Yeah,
keep
right?
trying.
Spot on.
That's right.
Yeah.
Wow. Well, this was wonderful. Thank you so much, Kelly. Can't say enough about, just sitting with us today. I know you're busy, and we really just appreciate the time and the wisdom and, the book recommendation, mostly the book recommendation. No, just kidding. But thank you. It's been a pleasure, and we really appreciate talking with you today.
Oh, thanks. A pleasure for me too. Thanks so much for having me on, and continue to really admire the work that you guys are doing, and it's exciting to be a part of. So.
Thank you, Kelly. We appreciate that. Thank you for your time. We know it's precious, and we are grateful that you gave us some time today. And for those of you that are listening to this episode, you can learn more about Kelly and her work at Platinum Group Advisors. We'll link her information in the show notes. I recommend go take a look at them if you're in the healthcare industry and you're looking for a great group to support that understands this business, that you can lean on, rely on, and just provide incredible guidance and oversight. Please take a look. Thank you all for tuning in today to Curitics Connect. We will see you next time. Bye-bye.
Thanks, everybody.